TDI or toluene diisocyanate is a sensitizer. TDI causes skin, eye and lung irritation, progressive impairment of lung function with long-term inhalation exposure, and is a respiratory sensitizer via both the dermal and inhalation routes of exposure. Chemicals called aromatic amines such as benzidine and beta-naphthylamine, which are sometimes used in the dye industry, can cause bladder cancer. Cigarette smoking together with workplace exposure to aromatic amines can act together to cause bladder cancer. The best biomonitoring approach for lead toxicity exposure is blood analysis. Organophosphorus insecticides act by cholinesterase inhibition. Carbamates also act by cholinesterase inhibition, but through a different mechanism. Velocity pressure of a system is always positive. The total pressure equals the static pressure plus velocity pressure. Since velocity pressure is always exerted in the direction of the flow, velocity pressure is always positive. Lethal dose 50 or LD50 is a measure of acute toxicity of liquids and solids that are administered by any route except inhalation. LC50 is used for airborne materials and so is an inhalation exposure measurement. These numerical values cannot be directly compared to each other. Rather, the relative toxicity of two substances could be implied by comparing the LD50 or LC50 of one substance to the corresponding value of the other substance. Cumulative lead exposure health outcomes may include impaired peripheral nerve function, renal impairment, increased risk of miscarriage, and hypertension. Diagnosis of lead poisoning is often missed because symptoms of lead poisoning are nonspecific and are mistaken for viral or other illnesses. Symptoms of organophosphate and carbamate pesticide poisoning include overstimulation of the parasympathetic nervous system, which is the rest and digest nervous system. This lowers the heart rate, raises sexual arousal, salivation, lacrimation, urination, digestion, and defecation. Sympathetic nervous system activates what is often termed as the fight or flight response. Risk reduction and control is primarily the role of the Environmental Health and Safety Department. Risk transfer is basically buying insurance. Risk avoidance is when the business decides not to produce high-risk products or to avoid certain markets. Risk control techniques include avoidance and reduction of risk, while risk financing involves a choice between retention and transfer of risk. Acetylene is a simple asphyxiant. Is an inert gas that excludes or displaces the oxygen supply to the lungs at high concentration. Carbon monoxide forms carboxyhemoglobin. Hydrogen cyanide inhibits the cell enzyme ferric cytochrome oxidase, and aniline forms methemoglobin, which are examples of chemical asphyxiants. Reactive metals are usually arc welded under a shield of inert gas such as argon. Metals that are welded in this manner include aluminum and titanium. Metal inert gas, or MIG, welding on aluminium produces a relatively small amount of metal fume. It does, however, produce a significant amount of UV or ultraviolet radiation and, as a secondary pollutant, ozone. The chemical challenger used in a respiratory quantitative test is polydisperse sodium chloride aerosol, or corn oil. Isoamyl acetate, known as banana oil, is only for qualitative fit testing. There are two types of fit tests, qualitative and quantitative. Qualitative fit test is a pass-fail test method that uses your senses of taste or smell of your reaction to an irritant in order to detect leakage into the respiratory facepiece. Qualitative fit testing does not measure the actual amount of leakage. What are the four stages of ionizing radiation syndrome? First, prodromal, minutes to days, where you have nausea, vomiting, and diarrhea. Second, latent, days of week with no symptoms. Third, manifest illness, hours to months, symptoms may vary, and is very similar to the prodromal. And fourth is recovery or death. Why are gonads more susceptible to ionizing radiation than muscle? Well, higher cell turnover means higher radio sensitivity because they multiply quicker and they don't have time to fix damaged DNA. Therefore, you can sterilize a person with radiation but not kill it. If an agent is bioactivated in the liver, it would be expected to be least toxic when inhaled, because the compound would enter the systemic rather than the portal circulation. If it entered the portal circulation, it would go to the liver before entering general circulation. The portal vein is the one that carries venous blood from the gastrointestinal tract to the liver. What is the difference between an ion and an isotope? An isotope is an element that has an equal number of protons and electrons, but different number of neutrons. Ions have different number of protons and electrons. Electrochemical sensors are most often used for carbon monoxide, nitric oxide, nitrogen dioxide, hydrosulfuric acid, and sulfur dioxide. These are in general most simple chemical monitors. A primary central nervous system effect of lead poisoning is behavioral impairment, which is low IQ. Chronic encephalopathy is characterized by gradual memory loss and psychomotor control loss, dementia, and motor disorders in general. Causative agents of chronic encephalopathy include arsenic, lead, manganese, and mercury. The metals associated with renal cancer are in general arsenic and lead. Chemical causing renal damage may include metals, including arsenic, cadmium, chromium, lead, mercury, and uranium. Non-metals such as carbon tetrachloride, chloroform, ethylene glycol. Vinyl chloride which is the monomer of polyvinyl chloride or PVC, and aflatoxin, a toxin produced by certain fungus, are examples of hepatocarcinogens that causes cancer to the liver. Chloroform and carbon tetrachloride are known to act on the liver, causing steatosis, acute reaction of lipid droplet forming in the liver, also known as fatty liver. Necrosis is also possible. Chronic hepatotoxicity, mostly from alcohol, may cause cirrhosis or hardening of the liver or cancer. Effects of chronic benzene exposure include damage to bone marrow, which in turn affects the stem cells related to blood and causes cancer of the blood and leukemia. At the tissue level, it is possible for toxicants to interfere with oxygen utilization. This condition is termed cytotoxic hypoxia or histotoxic hypoxia. Examples of chemicals that cause this acute effect are acetonitrile, cyanide salts, hydrogen cyanide, and hydrosulfuric acid. Hydrogen cyanide and cyanide salts are used in electroplating, dyeing, and tanning operations. Methemoglobinemia involves the oxidation of heme in the blood from iron 2+ to iron 3+. Examples of agents that may produce this effect include aniline, nitrobenzene, and nitrates. The end effect is hypoxia or insufficient oxygen delivered to tissue. Acetylene, argon, and methane are examples of simple asphyxiants. Carbon monoxide and methylene chloride cause hypoxia, that is when chemicals compete with oxygen in the blood, or chemical asphyxiation.